Hi, my name is Anna Straley. I'm a high school special education teacher. I've been teaching for 6 years now. I teach 9th through 11th grade, level 1 through 3 special ed, but I am also the high school's only behavior disorder teacher. So I have all those kids on my roster. The title of my study is The Effect of Practicing Mindfulness through Guided Meditation on Anxiety in Students with Emotional Behavioral Disorders. And throughout this presentation, when I'm talking about emotional behavioral disorders, I will just refer to it as EBD. My problem statement is students with EBD often have heightened anxiety, and this makes it difficult for them to function well in academic settings. And even outside of academic settings in school, unstructured and structured time. And it's not only difficult for them, it sometimes is difficult for other students in the room and teachers as well. Internalized and externalized symptoms leads to a lot of misinstruction time. Some of the symptoms of EBD, and this is ones that I had seen crop up again and again in the past research, and ones that I have seen over the past 6 years. Internalized can be anxiety, depression, attention problems, social withdrawal. Externalized could be physical or verbal aggression, disruptions in the classroom, elopement for escape, and non-compliance. Looking at the past research, I included this graph because it shows in 1970 there was little to no research on practicing mindfulness, and now, well, this shows up until 2015 it's shot way up. So there's been a lot more research in the last 25 years. Looking at the past research, there's a lot of evidence that shows that mindful-based interventions, and this includes guided meditation, yoga, just practicing breathing techniques and other things, shows that decreased anxiety in participants. I'm going to say most of the past research I came across had to do with patients with psychiatric disorders. And psychiatric disorders could be anxiety and things like that. There are some school studies too, and all the studies indicated that lower levels of anxiety would happen with practicing mindfulness on a regular basis. A study done in 2011 stated that practicing mindfulness regularly can help decrease the body's reaction to stress and increase awareness, which would really help students with EBD. The gap in the research, however, is there are only a handful of studies that strictly focuses on students with emotional behavioral disorders. My study focused on the mindfulness meditation theory. The mindfulness meditation theory revolves around the fact that if you practice mindfulness on a regular basis, you're going to have better emotional regulation, a better attention control, and better self-awareness. So instead of just reacting, you're calm and thinking, and this has beneficial outcomes, especially for students that have emotional behavioral disorders. The purpose of the study was to explore how practicing mindfulness through guided meditation helps students with EBD manage their anxiety and stress. And management of anxiety and stress is going to lead to that better awareness and better emotional regulation. My research design was participatory action research, since I'm also participating in the guided meditation when they were doing it. We would listen to CDs, and each one, I would skip it around, but it was guided meditation, but it would focus on different things. And I was walking around, helping them out, making sure they're doing stuff. I was also participating. So my data analysis plan, I had 3 participants. They're all diagnosed with EBD. They all have IEPs. There were 2 African American males, aged 14 and 15. They're freshmen in high school, and one Caucasian female, aged 17, and she's a junior. They are all low socioeconomic status, and I do have some of their background information, and I know they had pretty rough upbringings based from their IEP, so I know that there is some anxiety and stress there. During the study, we tried to practice daily guided meditation when I had them for that 30 minutes a day. I had them pretty much during homeroom, so we'd do it then, but there was some interruptions based on other school functions and things, so I didn't get them every day that I wanted. But I tried to do 15 minutes of the guided meditation, but that was also cut short a few times. And then we did this for 3 weeks. I think it was a total actually of 11 days, 11 or 12 days, because we missed a few days. I would give a weekly interview with 11 open-ended interview questions. So it would be a conversation that I would record in my journal, and then I would go through and code these interviews. Here are the interview questions. I would ask, what gives you anxiety? And I'm doing this one-on-one. What do you think about meditation? How do you feel about meditation in the classroom? During the practice, how did you feel? What were your thoughts during the practice? What does your body feel after? How does your mind feel after? How do you feel right now? How is your stress level? Describe how would you feel in one word, and I'd usually have a follow-up to that because that's kind of a yes or no question. How is your energy level? And is there anything else you would like to share about your experience? So each week I gave one interview to each student, so it was resulting in 9 interviews. So I had 9 interviews that I could code. So I had 2 research questions: how practicing mindfulness in the classroom helps students with emotional behavior disorders manage anxiety and stress, and how practicing mindfulness in the classroom helps students with EBD increase attention. Because according to the mindfulness theory, those 2 go hand in hand. And I did a thematic analysis for my code book. I did initial coding looking for a theme, and then I went through a few more times to find the themes that kept arising. So what gave them anxiety? Pretty much everything. School, family, friends, everything, teachers. The second theme that came about was how the body and mind felt during and after. And calm kept coming up, happy, relaxed, tired, and their thoughts on meditations. They think it's needed, they think it's relaxing, they think it's calming, and they think they like the quietness of it. I just did a quick compare contrast. All 3 of them said happy, calm, relaxed. Only 1, 2 said tired and quiet. So even though there's little past research on students with EBD, I think that mindfulness, especially guided meditation, if practiced regularly in the class, can really help with their anxiety and help with those other symptoms that arise because of their anxiety. There are some limitations. The data was cut short due to COVID-19. I did not get all that I wanted, and just our time allotment too wasn't real great. And I did not get to observe them in their other settings, which I thought I would, just to see how they were doing in other classrooms. And sometimes I feel like they were just doing what I said because I was a teacher and they were kind of humoring me. And they were supposed to actually get a pizza party for participating, but that was cut short as well. But my recommendations for future studies is just focusing more on students that actually have the heightened anxiety. And I really think that would help lessen the symptoms of their EBD. And that is my presentation. Thank you very much.